is there anything within primary care that you have seen change that you did not learn throughout
what I would say is it's just kind of like sports now, actually, very much metrics based, right? You pitch to somebody based on what their stats are. You shift based on that. Medicine more so being based on metrics. Dr. Iqbal was mentioning quality, or no, Dr. Pacheco, I believe you're mentioning quality as well, right? So how reimbursements occur with Medicare, patient outcomes, everything. When we say evidence-based medicine, that has to be in your practice. And so I guess one thing that has changed is that, like, whatever you learned in medical school, that's great, because you have to build on that, because it may be only applicable for right now, but there's going to be an update coming in the next month or the month after that. So I would say just having a mindset of that, like, whatever you learned, be prepared to unlearn it, because you have to be able to be flexible and adjust your practice as new things are discovered. So.
Makes sense. And yeah, I agree with you 100%. And Dr. Pacheco, would you mind emphasizing on that as well from your quality aspect?
Well, yeah, and just to reiterate, I mean, that is medicine. We're forever learners. So we're going to keep, the way we do things now is not the way we're going to do them in 10 years. I mean, it is what it is. I mean, the metrics and so forth, I think, is just another iteration of how far we've come to be able to track these kinds of things so that we can go back and make it better. So I constantly am tracking cancer screenings and how we care for diabetes, but it's not so much to tell you what you're not doing, but just to now layer in resources so you can do it. And so we can take the best care of our patients. I think the other thing that I wish that I maybe knew a little bit more about is just understanding the insurance world a little bit, because it is complicated and it does impact us as providers. Not that I would change my practice based on what someone's insurance has, but more, again, what can I give them, or what more can I do for them, based on those types of of those things. But I think it also helps me understand what my patient is experiencing on their end. So if they have a Medicare plan and don't have an Advantage plan, what does that mean for them? Or if they do have that, what does that mean for them? And so forth. And what's the benefit to them? And so I think it just makes us a little bit more well-rounded when we understand a bit of the business as well as the clinical competency portion.
Absolutely. I couldn't agree more. And Dr. Iqbal, you have extensive experience in many stages of primary care. What is one thing within primary care that you have seen that you did not learn throughout residency?
Well, I definitely agree that my residency was not really focused so much on quality measures and billing and coding and documentation, and the real world really is. And so that's something I wish I had more exposure to in a certain part of my life. But now the facility where I'm at now, we don't have to worry about it as much, and we may touch on that later. But that is such a big, huge part of medicine, the billing, the quality measures. So I wish that residency had kind of prepared me for that. But the other thing also to kind of think about is when residents go out and look for career positions is look at what type of person you are. Are you independent? Are you a solo learner? Are you one of those that doesn't do research on your own, but is more collaborative with colleagues? It's very important, because when things change in medicine, sometimes they change slowly, but more often they change very rapidly. And if you're in a solo practice or you're in a small group practice and something happens, the Women's Health Initiative shows you how old I am. Who do you go to get recommendations, like what is the new standard of care? And then, more recently, the COVID pandemic, we were getting messages daily from our administration of what the CDC guidelines were, and they were changing daily and weekly. And so we were informed very, very well. And I can't imagine if I was in a solo practice out there trying to navigate these changes. So kind of look within yourselves and see what kind of person you are as far as collaboration or solo or independent and that type of thing when you're looking at practice.